Is your skin changing faster than you'd like after 40? Today, Dr. Amy Killen joins me to explain how hormones, collagen, and even regenerative medicine play into the way we age and what we can realistically do to support healthy, radiant skin and hair. Welcome to All About You. I'm Dr. Shauna Watts, GP and women's health advocate. Every week, I bring you evidence-based conversations to empower you through midlife. Today, we're joined again by Dr. Amy Killen, regenerative and anti-aging physician, international speaker, and expert in aesthetics, hormones, and regenerative medicine. Together, we'll explore why our skin and hair change so dramatically after 40, the role of hormones and lifestyle in keeping skin and hair healthy, what regenerative therapies like PRP and stem cells really offer when it comes to aging well, and what you can do to support weight management in midlife. Remember, this is general information only, not personal medical advice. Always consult your healthcare provider for guidance. If you haven't heard our first episode together, Dr. Amy Killen began her career in emergency medicine before shifting her focus to longevity and regenerative health. She is now internationally recognized as a leader in sexual health and aesthetics, specializing in hormone optimization, platelet-rich plasma, stem cells, and exosomes. She co-founded Human Health, developed the full body stem cell makeover procedure, and launched the Human Optimization Project, a supplement platform for personalized health. Dr. Killen also speaks on global stages, including Mind Valley and Radfest, and her expertise has been featured in The Times, Newsweek, and Yahoo Life. Today, she's here to help us cut through the noise about skin and hair in midlife and explain what really works to keep us looking and feeling our best. Amy, one of the things I see again in clinic are women middle-aged coming who confidence is in their boots. They look in the mirror, they don't recognize who they see, they don't feel like themselves inside, but they also feel like what they look on the outside doesn't represent. Women will often say to me that they still feel 28 or 29 or 32 or whatever the number is, but they feel that, what they look like on the outside doesn't represent them. Why does skin and hair seem to change so quickly? And why do we have these sort of sudden times where aging just seems to accelerate? What's going on?
A lot of it is estrogen loss. Estrogen is so important for skin health. It's important for your collagen in your skin, for the formation of collagen. It's important for blood flow to your skin, elastin in your skin. It's also really important for your hair. In fact, about 50% of women will have hair shedding or hair loss around, midlife, around perimenopause, menopause. And most of that is due to loss of estrogen. Some of it may also be to, increased testosterone versus estrogen as well. But estrogen is, again, it's so important for all parts of your body. And so when we lose estrogen at menopause, during that 5 years or so, when it kind of falls off a cliff, we do have rapid aging often of the skin and the hair.
And do we know, does progesterone and testosterone have any impact on the skin per se?
Yeah, they both have some impact. Testosterone actually can be beneficial for the skin. Too much testosterone, can make increased oil production and can cause acne. So you have to be a little careful with testosterone, but it does have some skin benefits. And progesterone also has some hair benefits as well. We're a little unclear exactly the relationship between, or at least I am, between progesterone and the hair follicle, but I know that it is involved in hair follicle health. And I've seen some topical, even progesterone serums for the hair. I don't know if they work or not, but I have seen those out there.
Can I ask you about a theoretical patient just that I have in my mind of someone who is definitely struggling with low libido and wanting to try testosterone, but they're anxious to try testosterone because they've got their hair thinning and they're feeling self-conscious about their hair. How would you approach that situation?
That's a great question. It's interesting. I just did a Substack on this. Hair loss from testosterone is in the literature is actually not reported very often. In big study, the Lancet 2019, 8,000 something women, over 36 studies, and they didn't have hair loss as a major complaint from testosterone therapy. Dr. Rebecca Glazer's and all kinds of studies with very high testosterone doses for women, and her patients did not have hair loss. And yet, I hear stories of women taking testosterone who feel like their hair is falling out, and I believe them. And so I don't know exactly what's going on. Certainly there is a relationship between DHT, which is made from testosterone, and it can affect the hair follicle. We know in men it can cause hair loss. It probably causes hair loss in some women that are genetically prone to hair loss, but it's not a crystal clear relationship. So I guess my advice would be to just go slow with testosterone. Start it with a low dose, stay on it for several months, 3, 4, 5, 6 months at that dose before increasing it. And just also understand that hair loss in midlife is very common, not necessarily from testosterone, but just because of aging, estrogen loss, mitochondrial dysfunction, all the other things.
We're seeing, again, lots of people on social media talking about using vaginal estrogen cream on their faces, around their eyes. I know that you guys in the US do have some estriol creams. We don't have those here, but what are your thoughts on, there's also some commercially available products that have like ingredients that are meant to mimic estrogen in the skin. What are your thoughts on those type of things?
I think the early research looks promising. There are a number of studies on estrogen and skin. Certainly the majority of them are positive and show that they can help with hydration, skin barrier function, and those are the primary two things that we see. That can be systemic estrogen. So it could be like you're taking a patch, and that's helping your skin. So systemic estrogen can help your skin, and also, topical estrogen in that low dose that you're just putting on your skin. So both of those methods can help. I don't know if the local tonic topical on top of the systemic is helping any more than one by themselves. I don't think we have that information. But yeah, I'm bullish on it, but you just want to be, just be a little careful. You don't want to be putting on your entire body where it's not a low dose anymore.
Yeah, absolutely. In clinic, I see a lot of women in perimenopause, and their skin barrier is definitely not functioning very well. They're suddenly having sensitive skin. They've maybe been someone who could literally pop anything on their face, and suddenly now everything stings and burns and is irritating. What's going on there?
I think a few things. Certainly the skin barrier, part of that's estrogen. Part of estrogen's job is to keep the skin barrier intact. And so when you lose that, that's a big problem. The other thing that can happen in perimenopause is you could have a lot of histamine kind of going up and down, because estrogen can be kind of fluctuating up and down, which can cause histamine to go up and down, which can also cause some skin issues as well. So you've got kind of a double-edged sword there happening in your skin.
And then we have this collagen loss that everyone's always talking about, and everyone's trying to do all these collagen induction therapies, and should you drink collagen and should you not? But Amy, can we take a step back? Is collagen loss in our faces and in our skin related to menopausal hormonal changes? Do we know that, or is that something that's still out for debate?
Yes, it absolutely is. You lose about 30% of your whole body collagen during like the menopause transition. And that's your joints, that's your skin, that's your eyeballs. Like collagen's all over your body, right? Your bones. So we lose a lot because, again, estrogen estrogen helps your body to make collagen. It's like a signal to make collagen. So that is a big reason why we lose collagen at menopause.
Okay. And do you think there are meaningful things that women or anyone listening can do to stop that loss of collagen?
Take estrogen. I will say that the studies on I think that collagen supplements, like oral collagen supplements, like the collagen powder, there's some decent evidence for joint health. There's a few studies for bone health, and we have very conflicting studies for skin health. And I think at this point, I'm not recommending it for skin anymore.
Yeah. Okay. And is that connected to, I have women telling me they're feeling like eating enough protein has become a full-time job for them because they're trying to get enough in. Is that related? Eating enough sort of dietary protein, is that related to the amount of collagen in your skin?
Collagen is a type of protein. It's not a full protein, so you're not going to get all of your amino acids in collagen. I certainly wouldn't recommend consuming collagen as your protein source. I would just go get a steak or some good whey protein. But so I don't know. Certainly protein, if just any kind of protein has the amino acids that your body can use to make collagen. So certainly, even if you don't drink collagen smoothies, you can, as long as you're eating protein in general, you can make yourself collagen in your body if you have the signals like you have the estrogen and things like that.
Ladies, are you feeling flat, foggy or like you've lost touch with who you used to be? Well, it's time to rediscover you. After 25 plus years as a doctor working with women as a GP, an aesthetic doctor, and in women's health, I've created the 16-week Rediscover You program to help you reclaim your energy, confidence, and vitality. This guided evidence-based journey is specifically designed to support you through the perimenopause and menopause. Together, we'll reset your hormones, boost your energy levels, create sustainable weight management, and restore the clarity and glow you deserve. We'll take a deep dive into what's really happening inside your body, from hormonal shifts and skin changes to disrupted sleep patterns and mood swings. You'll get the tools and understanding to navigate the powerful transition with confidence, clarity, and care, because you deserve to feel like you again. Our waitlist is now open. Click the link in the show notes to save your place. Often women will say that they feel like they look tired. Is this related to the awful sleep that they're having, or is it related to something else?
I think it's everything. I think it's the bad sleep that starts happening in perimenopause. I think it is the loss of collagen. I think it is the stress, the cortisol that's all over the place. Any number of other things, all the symptoms that people have that maybe are ignored and that it's stressful for them. It's the relationship stress that they're having because maybe they're not having sex anymore. Like, it's all like piling up on you in perimenopause, and that's enough to make anyone look tired.
Absolutely. And do you see in your clinic confidence levels being very low in this age group?
I do, and it's interesting. One of my very first patients, when I first left the ER, I opened up a clinic. I was doing just hormones. I moved to Portland, Oregon, out of the blue, and this woman came in. I remember her very clearly. She came in and she was so angry. Like, she's like cursing and slamming doors, and the parking garage was stupid, and this is stupid, and I hate this. She was so angry, and we ended up getting her on some estrogen and some supplements. And I remember she came back like 3 months later, and it was like a different person. Like, she was like smiling. I think she gave me a gift. Like, it was like, I didn't even recognize her. And so I still have her in my mind. Like, loss of hormones or just chaotic hormones during this time, it can make you feel like you are losing your mind. I hear that all the time. And just know that this is completely, unfortunately, normal, because these hormones are so erratic and eventually kind of go away, and treatable also.
Yeah, absolutely. If a listener could do only 3 things consistently to sort of improve the appearance and health of skin and hair, have you got a couple of tips for us?
Number one for skin is sunblock, like a mineral sunblock on your face if you're going outside. I do like the sun. I think some sun exposure is important, but it is the number one cause of aging in the skin. So sunblock for skin, a good retinoid for skin as well before bed is fantastic. And I also really like red light therapy. Red light therapy has better evidence for hair than it does for skin, but especially if you're starting to have thinning on your scalp, using those red light therapy caps, as long as they're good quality and good power, those actually have a lot of good evidence for them.
Can you tell me a little bit more about your thoughts on red light therapy? I'm very excited. I have just got my whole body red light therapy bed delivered back. We had some renovations and it had to go into storage, and it's coming back, and I'm like literally going to be scooting up there to get under it. But can you explain red light therapy?
So red light therapy is also called photobiomodulation, and it's basically it's light that's usually red or near infrared light. So it's kind of in the 600 to 1,000 nanometer wavelength range. And basically what happens is it gets in through your skin. It can just go a couple of centimeters in, but it causes the mitochondria, the energy producers of your skin, to be able to make more energy, to make more ATP. And that's kind of the primary mechanism there. But there's all kinds of other benefits. Because of that, we can see less inflammation. We can see it can help with skin, rejuvenation or skin healing. Like, if you've had a laser treatment and you need to heal faster, wearing a red light every day for a few days is great. And then for the hair, we know that red light can actually stimulate the hair follicles to move from the kind of resting, dying phase into the growth phase called the anagen phase. We have tons of research on that now, and that it's a great way to kind of stop hair loss and then promote hair growth as you get older. So red light's great for skin health. It's great for hair health, but it also can be helpful for just full body, improving energy production and reducing inflammation, and it's fantastic.
Yeah, I feel like my patients sleep better as well. It kind of seems weird that it gives you more energy, but it also helps you sleep. But that's kind of been anecdotally what we've found, which is awesome. Amy, in my clinic, I do find that a lot of women are completely overwhelmed as to where to start with skincare, whether they've been someone who's always done skincare or someone who's really never delved into it. It seems like everywhere you look, there are new ideas. There's snail mucin and peptides and like
Salmon
no,
sperm.
no, yeah, no one knows really what to do. And it can be overwhelming. I even had a lady on Monday and she literally brought in this massive bag, which she poured out onto the table. And I think we counted, there was like 39 different products in there. And this poor woman had there was thousands of dollars of stuff and she did not know where to start. She said, I keep buying these things that keep coming up on my feed and I just keep buying them in bed at night, hoping that for a miracle. We did have a giggle because most of the time she didn't actually put any of them on her skin. She was just buying them because she was overwhelmed and didn't know where to start. Can you tell me from an evidence-based approach what you think would be sort of the minimum things that would be helpful for a woman to use it in skincare?
I mean, the most evidence is for the sunblock, and I like a zinc oxide or titanium dioxide, mineral sunblock every day. Make sure you're putting it on your face and also your neck, and also I've learned about your upper chest. Like my upper chest has aged like 10 years recently, because I just keep forgetting to put it on there. So put it on all those areas. A retinoid, which can be a prescription or it can be an over-the-counter. So it can be like a retinol, which you get from the drugstore, or it can also be something that's stronger, like a tretinoin that your doctor can prescribe you. And that's something you want to put on before bed. And that has a ton of evidence for cellular renewal and cellular regeneration in the skin. And then I also like some sort of antioxidant serum. So maybe it's a vitamin C serum, maybe it's there's all kinds of other antioxidants that are out there, resveratrol and various things. But something that's going to, as astaxanthin's a great one, that's going to help your skin be able to respond to stress from the environment, oxidative stress and things like that, and help it to repair. So I would start with those three things: a good antioxidant serum, retinoid, and a sunblock. And then you can always build on that afterwards, cleansers and things like that, obviously, as well. But those are the primary ones for me.
Okay, love it. And if you had a patient who's listening, someone who's listening, and they've got thinning hair and they're really like freaking out about what they can do, and they're buying all these shampoos and trying to take all these supplements and for hair and skin, like where would you start with that type of patient?
So I would start, if it's a woman especially, I would start with some lab tests. I would make sure that her thyroid is okay, that she doesn't have low or high thyroid, that her iron is okay. We want iron ferritin to be somewhere in the 50 to 80 plus range, usually for optimal hair growth. Just make sure all the sort of normal labs are okay, that there's nothing else going on in the body that's causing hair loss. And then also look at your medications. Sometimes those will cause hair loss. If you kind of ruled out some of those things, then you can start thinking about what, just general treatment options. Minoxidil has a lot of evidence behind it. It's going to be helpful for at least 50% of women. That's just Rogaine. You can get it at the grocery store. Get the 5%. It's stronger and it's better usually for women. So that's going to be a first line option. The red light therapy is another option, like I said. And then you can, after that, start to think about some other things that might be helpful. Like there are some different peptides that are available now. There's some different hair serums that are targeting senescent cells, like the zombie cells in your hair, that are available now. So there's some other things that are out there, but I would start with ruling out the things that you can fix easily, like your thyroid or your iron, and then start kind of stacking your therapies on top of that.
And taking a vitamin that seems to be, or a supplement that says specifically for hair and nails, do you think that it's worth investing in that type of thing?
Oh, I don't generally recommend. I mean, I think it's fine. I don't think that it's bad, and maybe it helps you. Most of those are going to have some different herbs and things that help with inflammation in the body and help to, decrease your general inflammation. So it depends on how healthy you are, how inflamed you are. There's a lot of things to think about, but in general, I don't necessarily recommend that you have to take that.
Amy, I also see a lot of women in my clinic, and I'm sure you're the same, who are getting really upset about weight gain, belly fat, and they're really ticked off because they're doing what they've always done. They're like, I'm not eating any differently. Sometimes they're going to the gym too much because they're so upset about what's going on. I would love if you could help our listeners understand what we know at this stage about what is going on. Why is everyone getting belly fat? Why is everyone putting on weight? Why are some of us even getting fatty livers? It's so unfair.
It is so unfair. It's not fair. A lot of it comes down to estrogen again. The estrogen leaving. What happens is when estrogen kind of goes down, and again in perimenopause or menopause, your fat stores shift from like your thighs and your butt to your belly. So you now have this like inner tube kind of around your waist that you didn't have before. And so it's unsightly. You don't like it. The other thing that happens is fat also shifts and gets into and around your organs inside your body. So you spoke about fatty liver. And that's one of the things that we see is that estrogen drop has shifted your fat to areas where we really don't want fat because it's actually really bad for us and very inflammatory. So that's one of the things that's happening. The other thing that's happening is that because of aging and probably loss of estrogen as well, we're also losing muscle mass as we get older. And so your muscles are getting smaller and you're getting more body fat instead. And that, of course, is making you not look as good as you did when you had more muscles. So it's both it's a movement of the fat and it's a loss of muscles, kind of in combination.
And so what can these women do? Because they're so frustrated. They're often women who have managed to always keep their weight reasonably under control, and now it feels impossible. I have countless women who sit in my clinic and they're crying. They're absolutely devastated. They've spent a fortune trying all sorts of things, and they kind of don't know where to go. How would you approach that?
It is such a hard thing because, yeah, like you said, they're doing all the things and they put a lot of stress on themselves. And I totally see that as well. I would start with trying to work on muscle building, like really focus on muscle building. Don't spend as much time on the treadmill or as much time, doing that like zone 2, just, cardio. Really spend more time on building muscle in big muscle groups and maybe doing like short kind of sprint workouts in between. Instead of maybe the long treadmill workouts. And then I would really, work on protein in your diet, protein and fiber, like you said, like you're eating protein and fiber like it's your job. So keep focusing on those things. Consider hormone therapy if you're not already on it, both estrogen and testosterone and progesterone if you need it or if you are having symptoms of those things. And then maybe, give yourself a little bit of grace because a lot of things are happening in your body and you kind of got to refigure out your new body.
Yeah, absolutely. A lot of women seem to be quite concerned about starting hormones because they're worried that it's going to make them put on more weight.
Yeah, it's an interesting kind of urban legend, and I say that knowing that some women certainly do gain weight when they first start hormones. So it's not like it doesn't ever happen. But if you look at the kind of the body of literature, women who take hormones actually tend to have some weight loss over time, or at least the weight is stable. It doesn't cause weight gain. But I will say that both estrogen and progesterone and even testosterone, when you first start them in those first 2 or 3 months, can cause some water retention. And so it can be one of these things, especially on high doses where you've gained, 10 pounds. And it's not that you've gained 10 pounds of fat, but it does make you feel pretty bad because you've got water in places where it shouldn't be. What I tell my patients is, we can start slower, right? Like slower doses will go a little slower. But estrogen is fantastic because it helps your body to retain water. So it helps your skin to retain water and stay hydrated. It helps your eyes. It helps your vagina, but it helps your whole body to retain water. So the retaining of water that happens when you first start estrogen is totally normal. And certainly it should get better within 2 or 3 months, but we can reduce the dose, go a little slower, and you shouldn't see, a 20-pound weight gain when you start these hormones. That's too much.
And what about using weight loss injections like the GLP-1s in this group? So like the Mounjaros, the Wegovy's. Are you a fan of those medications in this age group?
I am. I think that those are fantastic drugs just in general. I think that, we see every day, I'm sure you do as well. Like every day I see a new paper that's come out about something else that those drugs benefit. Now, certainly they're not for everyone, but I think that there's good evidence that they pair well with hormones, that there's no contraindication to putting them together. And, those drugs can help with weight loss. They can help with the insulin resistance that comes also at menopause. They can help with some of the other kind of inflammation that happens at menopause, the fatty liver that happens at menopause. And so they're a nice pairing, I think, with HRT or hormone therapy.
There's a lot of chatter here at the minute about microdosing them. Is that something that is being talked over there?
Yeah, absolutely. And it's funny. It's certainly not as well studied, obviously, as the traditional doses that have been studied by the pharmaceutical companies. But I have been using microdoses with patients, and that just means doses lower than the prescribed dose, right? Like it's not like a single dose. It's kind of a ambiguous kind of dose. But we've been using those for patients for several years, and patients not even that need weight loss. Like some people don't need to lose weight, but they've got like a lot of inflammation. They've got maybe arthritis. They've got, something else going on that we think those medications might help with, polycystic ovarian syndrome, things like that. And they can be really helpful at those little low doses that don't even cause weight loss for some of those things. I think we'll see more and more about that published, hopefully, eventually.
And your patients, if you take patients on a bit of a weight loss journey with a GLP-1, are you trying to, over here, I think it's the same there. They're very expensive over here. So it can be quite difficult for people to continue to use them long term. But in an ideal world, if all things were equal, would you try and keep your patients on it, even a smaller dose?
Yeah, if I can, I'll keep them on a small dose, like, even like a microdose or even like an every other week dose. These drugs tend to have a long half-life. Their half-life is about 7 days or so, which means they're really going to stay in your system for longer than that. So some people can get away with dosing like just twice a month versus every week. And then sometimes they'll get away with just a little bit lower dose and we can make it stretch that way. But, it's like any medication. Unfortunately, when you stop it, the benefits will go away.
Yeah, absolutely. And Amy, I know that you're kind of always at the cutting edge of everything, wellness, and but obviously people listening will have heard a lot of talk over the last 10 years about gut microbiome and what your gut bugs are like and whether they're good or bad, and more recently we've heard a lot of chat about the microbiome on the skin, and more recently we've been hearing a bit of chatter about the microbiome in the vagina and the vulval area. Can you tell us a little bit about, are those three things connected? Why should we care? Is this where medicine's going?
Yeah, I think it's such a fascinating topic. I love, I'm not an expert in microbiome, but that they are connected. We know that the skin microbiome, for instance, and what you put on your skin can also affect your gut microbiome, like the ingredients, the chemicals, the endocrine disruptors, like all of these things are connected. The vaginal microbiome as well. Certainly, we also know that when you lose estrogen, guess what it affects? It affects your microbiome all over your whole body. Your vaginal microbiome shifts to one that's not as good, essentially. Like that's why you get so many more infections, vaginal infections, at menopause. Part of that is that shift into microbiome and a shift in the pH in your vagina. We also see shifts in the microbiome in the gut as well when you lose estrogen. So estrogen is it's like the queen, like she speaks to the whole body. But yeah, I'm fascinated by the microbiome as well. I hope we learn more about, kind of how to precisely make changes and fixes as we go forward.
Okay. I promise you, I'm nearly down to my last question, so I've been picking your brain a lot. I just wanted to know what your thought was for people who still continue to say that menopause is natural and that we should just be letting nature take its course and we're interfering by giving people hormones.
No one's forcing you to get hormones. So if you don't want to take them, that's totally fine. But I just think there are so many things that are natural that are not great. Dying in childbirth, natural, but not great. Arsenic, natural, but not great. There's obviously a list of things that are natural, but maybe not good for our health and our long-term happiness. And I would argue that menopause is, it's weakening us, physically weakening us because of those loss of hormones. And certainly there are other things you can also do besides hormones to stay strong. And you should be doing those things, lifestyle things. But hormones are another piece of that puzzle and another way to help keep you strong and healthy as you go forward.
Is there anyone in your mind who absolutely should not have hormones?
The biggest population of people who shouldn't have hormones, are at least right now, are people who've had breast cancer history, with estrogen or progesterone positive tumors. I do think that there certainly is evidence that they probably can, but we just don't know for sure yet which people are going to be at higher risk for recurrence of disease with hormones. And I think that that's a big gap in our research currently. So I wouldn't say they can never have hormones, but it is kind of the highest risk population. And then if you have severe liver disease, we don't give you hormones usually. And if you have any kind of undiagnosed vaginal bleeding, we wait to fix that and make sure it's not, cancer before we give you hormones.
I feel really bad for that cohort of women who are, probably somewhere between 60 and 80 right now, who, I have to admit, even in my own practice, conversations around hormones where I felt uneducated about it for a long time. I didn't really know what to do. And, I was still being absolutely influenced by the WHI study. But is there an age where you think is too old to start HRT, or do you think there are any limits?
I think all women can start low-dose vaginal estrogen. So there's no age that's too old for that. If you could be 85 and you could start low-dose vaginal estrogen. My mom is in her 70s, late 70s. Actually, she's still on oral systemic estrogen also. But she, I told her, I just got her on low-dose vaginal estrogen because I was like, you need to be on this. I don't know why you're not taking it. So that's for everyone. In theory, like a estradiol cream is probably safe to start at any age. The only thing I think about is, do you want to be 80 years old and starting to have vaginal bleeding because someone gave you estrogen? Like, you have to kind of think about some of the side effects that can go with starting hormones. Not that the hormones are not safe, but like the side effects can be problematic. And honestly, we just don't have data that what happens if you start hormones 20 or 30 or 40 years after menopause. Like, we just have no real data on that. So it's a gap in the knowledge, and I just don't know for sure.
I know we should have talked a little bit more about vaginal hormones a little while ago, but in terms of sexual wellness, do you feel like vaginal hormones are helpful for that?
They're so helpful. They're like, it's one of the most helpful things. If you have a low estrogen state, like, so if you have a woman who's either perimenopausal, menopausal, or for instance, breastfeeding for 3 years and has had, low estrogen, or is amenorrheic, has no periods because they're overtraining, or they have an eating disorder, or they're on birth control also. That's another cause of a lot of kind of low estrogen state in the pelvic floor. Any of those people really can benefit from this low dose vaginal estrogen that just, we put it in the vagina 3 days a week, and it basically stays in the pelvic floor. So it's not putting estrogen out in the rest of your body. So it's very safe, and it can make a huge difference in health of the tissues, blood flow, sensation, ability to orgasm, like all the things.
Okay, awesome. I love vaginal estrogen. I think literally we should be going to the nursing homes and getting everyone on it, because they just have endless UTIs as well.
I know. I was in the ER. I was just thinking about all those little old women who came in with their sepsis, their urosepsis, infections in their body from their bladder infections that, oftentimes would kill them. And a lot of this, we know we can reduce these significantly with vaginal estrogen, but just unfortunately, it's not widely given.
Yeah, absolutely. My final question, I promise, is if you could chat with 20-something-year-old Amy, what would you tell her?
Honestly, I think I would just tell her to have a little bit more fun. Like, I had a good time, but I look back and like, those were some years when I was pretty like heads down and I was studying a lot. And I wish that I had just had a few more adventures and been a little bit more risky, maybe like had a little bit more fun back in the day.
Oh my God, you sound just like me. Thank you so much. You have been so generous with your knowledge and sharing it with us. Thank you for coming on the podcast today.
This was so fun. I'm so glad we got to meet. Thank you.
Thank you so much. Here are my 3 takeaways from today's conversation with Dr. Amy Killen. Hormones play a major role in how our skin and hair age, and understanding them is the first step to taking control. Lifestyle foundations, sleep, stress management, strength training, and nutrition are more powerful than any cream or serum. Regenerative therapies like PRP show promise, but they work best alongside the basics, not instead of them. Thank you for listening to All About You. If you find this valuable, please follow, share it with a friend, and check the show notes for resources from Dr. Killen. Until next time, I'm Dr. Shauna Watts, reminding you that informed health decisions start with you.